GLUT1 deficiency syndrome is a disorder with a set of neurological symptoms and disorders caused by the insufficient amount of glucose concentration inside the brain. The cause of this disorder has two roots. One is where the child inherits the autosomal dominant genetic mutation of SLC2A1 gene, or have a new mutation of the same gene where no history of the disorder can be traced back to previous generations. The mutation of SLC2A1 gene leads to a deficient production of glucose transporter protein type 1, also known as GLUT1, where its function is to transport glucose into cells from the blood or from other cells for use as fuel. GLUT1DS, or GLUT1 deficiency syndrome, is associated with multiple disorders such as abnormal erythrocyte morphology, ataxia, dystonia, encephalopathy, and more noticeable ones such as spasticity, seizures, developmental delay of motor and mental milestones in the domains of development of a child, and microcephaly, where the child's head is smaller than normal and falls behind in progression as they go older. The symptoms generally develop during first few months of a newborn child and will progress through puberty.
Glucose is one of the biomolecules that serve as our energy source, the fuel of the body, and without it, our cells ceases to function properly and our metabolism will be irregular in extreme cases. It may be result to a variety of neurological signs and symptoms, one of which is a GLUT1 deficiency syndrome. It is a rare genetic metabolic disorder resulting from the mutations of SLC2A1 gene, the gene responsible for providing instructions for producing glucose transporter protein type 1 or GLUT1. This protein transports glucose into cell from the blood or from other cells for use as fuel. In the case of GLUT1 deficiency syndrome, inefficient amount of GLUT1 proteins in the brain means the brain does not receive enough glucose across the blood-brain barrier and lack the energy source to develop and function properly. This major defect results to set of disorders like microcephaly, a condition where a baby's head is much smaller than expected, difficulties in coordinating movement called ataxia, experiencing episodes of confusion called lethargy, and moments of spasticity or even seizures. This genetic disorder is usually inherited in an autosomal dominant patterns, and that is why it is such a rare syndrome, with the prevalence estimated at 1 in 90,000 people in Australia and approximately 500 reported cases worldwide since 1991. Though it may be that case, about 90% of cases of GLUT1 deficiency syndrome result from new mutations in the gene, where the gene is not passed from previous generations, rather a sudden mutations of SLC2A1 gene resulting to such a disorder.
GLUT1 deficiency syndrome is caused by mutations in the SLC2A1 gene. This gene provides instructions for producing a protein called the glucose transporter protein type 1 or GLUT1. The said mutation causes body movement disorders, developmental delay, speech and language abnormalities, intellectual disability, and others to people diagnosed. The symptoms usually begin within the first few months of life, the first 6 months to be exact. However, the severity can vary from person to person. There are mild cases and there are severe cases that may lead to complication, and that is why people affected with this syndrome needs to see a doctor to know about the prognosis and also the ways to manage this syndrome, because GLUT1 deficiency has no cure. It may also result in hypoglycemia or abnormally low glucose concentration, also in low lactate levels, low energy metabolism, reactive astrocytosis, microcephalia, and other clinical signs such as epileptic seizures that are often unresponsive to anticonvulsants. I will use brain as an example because it is one of the most active organs that receives the 20 to 25% of the total glucose in our body, and because of the deficiency, the capability to transfer glucose and the capacity of glycogen, which is the storage for our glucose, will become low. Brain needs a continuous supply of glucose because it serves as the fuel and the source of energy that is readily available when needed.
Diagnosis: GLUT1 deficiency syndrome is a metabolic encephalopathy that shows complex movement problems and neurological disorders that commonly shows early on newborns or infants and develop further through puberty. These are sets of disorders symptoms of GLUT1 deficiency syndrome. First is ataxia. It's dysfunctions of the cerebellum. This causes lack of coordination between muscles, limbs, and joints. Next is dystonia. It abnormally increased muscular tone that cause fixed abnormal postures. Next is developmental delay. It retarded psychomotor development. Dysarthria, difficulty in coordinating movements and speech difficulties. Next is hypoglycemia, abnormally low glucose concentrations in the cerebrospinal fluid. Lethargy, experience episodes of confusions and lack of energy. Microcephaly, the head circumference falls progressively behind. Next is myoclonus, headaches or muscle twitches. Spasticity, stiffness caused by abnormal tensings of the muscles, and lastly, seizures. Main diagnosis of GLUT1 deficiency syndrome is based on the clinical features set above in combinations with determining the glucose concentrations in the CSF or genetic analysis through a lumbar puncture. Lumbar puncture is a needle that is inserted into the space between two lumbar bones to remove a sample of cerebrospinal fluid. A low glucose value in cerebrospinal fluid that confirms GLUT1 deficiency syndrome is less than 2.2 millimoles per liter or lowered CSF plasma glucose ratio in less than 0.4. Hypoglycemia, abnormally low glucose concentrations in CSF in setting of normoglycemia, normal concentrations of blood sugar, characterized the impart glucose transports into the brain. Genetic mutations of SLC2A1 gene is confirmed by molecular analysis of the GLUT1 gene. Red blood cell uptake assay is a high specialized lab test that may confirm GLUT1 deficiency is not commercially available.
Glucose transporter type 1 deficiency syndrome or GLUT1 deficiency syndrome is a rare disease and an umbrella term for a lot of other conditions, and because of that, the disorder might not be recognized at all at some point, and in some other cases it might be misdiagnosed because it has similar symptoms to those conditions under it, and because of that it is hard for the experts to really determine how often and how common it happens in a general population. Since 1991, when it was discovered, there are several thousands of cases that has been recorded, and as per the data says, in every 24,000 people, that one of those can get the GLUT1 deficiency syndrome, and it affects both genders, male and female, and race is also not a contributing factor whether you get the disease or not.
Now, as for treatment, there may be no cure for GLUT1DS, but there is treatment to prevent seizure activity and to provide nutrients for the body. Since GLUT1DS cannot use glucose for their main source of energy, ketogenic diet is one of the best treatments for this type of disorders. Ketogenic diet is a low carbohydrate but very high fat diet that has diverse effects on health and is expected to have a therapeutic value in neurological disorders, metabolic syndrome, and some cases of cancer. This diet shifts the metabolic state of a patient, producing ketone bodies and serve as alternative energy source of the body. The main ketone groups are acetoacetate, beta-hydroxybutyrate, and acetone that are generated from dietary fatty acids such as oxidation in the liver. This then readily penetrate the blood-brain barrier and provide an alternative fuel for the brain metabolism. Both acetoacetate and beta-hydroxybutyrate are 4 carbon molecules that can readily be converted back into acetyl-CoA by most tissues of the body, especially for the brain. However, acetone is the carboxylated form of acetoacetate where most tissues cannot convert it back.